As of today, there are nearly 10,800 confirmed cases of monkeypox in the United States, with 202 of those cases in Massachusetts and none in Needham. After living through a pandemic and lockdown, it is reasonable for people to be concerned about another illness spreading across the country. We spoke with the Needham Public Health Division's epidemiologist to find out more about the virus and what preventative measures residents should take.
Why did the U.S. Department of Health and Human Services declare the monkeypox outbreak a public health emergency, and what does that mean?
Monkeypox has been declared a public health emergency largely just to open up resources for us to combat the spread of the disease. So the U.S. Department of Health and Human Services can unlock funding, more resources, we can vaccinate more people. It expands the CDC's ability to share data. It doesn't mean that the United States expects there to be millions of new cases in the next month or so, and it doesn't actually call for any specific action from the public at the time. But it just, again, unlocks tools for us to stop it from becoming more widespread, and it also shows that the government is taking it seriously.
How is the virus transmitted?
I think it's important to highlight that monkeypox and COVID are very different. They're transmitted very differently. Monkeypox is not spread very easily from person to person. It's largely spread from direct skin to skin contact with scabs or lesions or bodily fluids. It can be spread through items that touched those lesions, like towels, bedding, clothing. So that would be important for household contacts. But this is less common. It can also be spread through droplets. So we heard a lot about droplets during COVID, but it's spread through larger droplets, and that requires usually prolonged face-to-face contact.
What are the symptoms, and how long does the illness last?
The symptoms can vary from person to person. They can start with a rash, or they can start with flu-like symptoms. So again, this can be vague: fever, fatigue, chills, maybe swollen lymph nodes. And after developing flu-like symptoms, within about 1 to 4 days, most people develop a rash. Again, it may start with a rash, it may start with the flu-like symptoms, it varies. The course of the disease is about 2 to 4 weeks, and you're supposed to stay home and stay isolated until any of those sort of blisters or pimples or scabs on your body have fallen off and you have healed skin.
Who should get the monkeypox vaccine, and where is it available?
The monkeypox vaccine is a 2-dose vaccine, and there is an extremely limited supply of it right now. So only certain populations are being prioritized, only some are eligible for the vaccine. So that is known contacts of monkeypox cases. So you've been identified through public health investigation or contact tracing as a contact. It's also presumed contacts. So those are people who have had a sexual partner in the last 14 days who has been diagnosed with monkeypox, or someone who has had multiple sexual partners in the last 14 days and lives in a jurisdiction that has monkeypox, which Massachusetts is. So those are the people who are currently eligible for the vaccine, and your healthcare provider needs to determine your eligibility. They need to confirm it. Once your eligibility is confirmed, you can make an appointment at select locations that are available on the mass.gov website. Very recently, the Department of Health did decide to prioritize first doses of the vaccine. So because of the limited supply, only first appointments are being made, and no second dose appointments are being made at the moment until more become available. And this is partly because of the limitations with the supply, and partly because the evidence points to the fact that one dose provides a sufficient amount of protection against monkeypox, and that receiving the dose weeks or months later, that second dose does provide a very hardy long-term immunity.
Should Needham residents be concerned about getting monkeypox?
As far as I know, there have been no deaths in the United States due to monkeypox, which is great. There is a treatment available. There is a vaccine available. So, right, the question is, why are we concerned about monkeypox? I think one of the important pieces here is that COVID has created a unique situation in which you may not be feeling well, and you may take a COVID test and the result is negative, and you think, I'm not feeling well, but I'm not COVID positive, so I'm going to go out and about. And we need to keep in mind that there are many other things that you may be sick with. And if you don't feel well, you need to stay at home. Monkeypox, as I mentioned before, is kind of a long course of disease. And so if you have monkeypox, you are home for 2 to 4 weeks isolating by yourself. And I think that that is really important, even despite the fact that, you know, you may survive and there is a treatment and a vaccine available.